Saudara Presiden Joko Widodo dan Menteri Kesehatan Terawan Agus Putranto mengumumkan langsung kasus corona pertama di Indonesia.
It has been 1 year since President Joko Widodo announced that 2 Indonesians have been tested positive for the Covid-19 and became the first confirmed case in Indonesia. Up till today, Indonesia has become the country with the most cases in Southeast Asia. Based on the Ministry of Health report as of March 11, 2021, the total number of corona cases in Indonesia has reached 1.4 million cases with a mortality rate reaching 38,000. Social activity restriction policies, such as the Indonesia Large-Scale Social Restriction or PSBB and the Public Activity Restriction Enforcement or PPKM have been implemented by the government for handling COVID-19 to suppress the transmission of COVID-19. As the 5th largest elderly population in the world, data projected the number of elderly would reach 39 million in 2030, equal to 13.2% of the population. The coronavirus pandemic is impacting everyone, but the older you are, the more severe the health consequences. Based on statistical report, 10.7% confirmed cases in Indonesia are elderly. The elderly are becoming the group with the highest mortality rate due to COVID-19. WHO warned that elderly people, especially those with comorbid conditions like diabetes and high cholesterol, are more at risk. The virus is not just threatening their lives and safety, but also threatening their social networks, their access to health services, their jobs, and even their pensions. Evidence points to challenges in access to healthcare by older persons and to the negative impacts that measures to limit the spread of COVID-19 can have among this age group, especially in relation to their access to social services, including social protection. During this pandemic, there has been a surge in the need for high health services for patients affected by COVID-19. With limited access and source of health personnel, this can certainly cause disruption to the health system. Hospitals are in a critical situation. Several hospitals have started to run out of beds. Having more COVID-19 cases would mean that the hospitals might no longer have the capacity to treat patients. This situation makes some older people feel worried. As a population that more vulnerable, it makes them more difficult to attend the health care that they need. Concern over the transmission of COVID-19 has led some older adults to switch health facilities, resulting in no longer travel time and have to pay a higher price. Some of them even choose to stop getting routine health services. This is just the one challenge of accessing healthcare. Then what about other problems such as the loneliness or mental health and etc.?